What symptom might signal a Herxheimer reaction in a newborn child? There are 4 answers in this quiz. This is part of a Common Sense Lyme series. With the 4 answers, is it runny nose, mild diaper rash, sudden fever, and rapid heart rate, and sleeping through the night? So I'd like to address this case that was discussed by Prodonic in 2020 and answer a number of questions about a Herxheimer reaction in a newborn. The case was a 21-year-old newborn with decreased activity, poor feeding, abdominal distension. A tick had been attached 5 days earlier. There was an erythema migrans rash. So the presumptive diagnosis was newborn with an early localized disease. IV ceftriaxone was given, likely because oral antibiotics are tough in that child and they were in the hospital. And within 2 hours, the newborn developed a Herxheimer reaction, according to the authors, with fever, tachycardia, and other related symptoms, which I'll get into shortly. The outcome was the symptoms gradually reduced with treatment. The Lyme disease testing was negative because likely the newborn didn't have time to develop an antibiotic response, and sometimes antibodies for the mother may not allow for a positive test. So what is a Herxheimer reaction? It's sometimes called Herx on the patients who want to abbreviate it. Jarisch-Herxheimer was originally a term used to discuss getting worse when someone has syphilis or some other infections like relapsing fever. It's usually a sudden onset of symptoms after early treatment. Now, what actually happens with a Jarisch-Herxheimer reaction? The initial theories was that endotoxins. Later, they weren't so sure it was endotoxins, so they thought a rapid killing of spirochetes releases bacterial components. Right now, we know that there's cytokine responses like tumor necrosis factor. It leads to a systemic cascade with observed symptoms. Now, in this case, is that the significance important is that clinicians must be prepared for a Jarisch-Herxheimer reaction in a newborn. And given the limited immune responses, there was a concern about how the newborn would be able to handle a Herxheimer reaction. Now, the broad symptoms of Jarisch-Herxheimer reaction were outlined by Nytuk and colleagues, and that includes fever, severe polymyalgia and arthralgias, chills, hypotension, tachycardia, non-pruritic rash, nausea, headache, and just a worsening of existing symptoms or new symptoms. So it's a broad list. The conclusion that Prodonic and colleagues gave was that early recognition and treatment of Lyme disease in newborns is important. It's important to recognize this case, although not everybody gets a tick, not everybody gets a rash that's a newborn, so one has to at least keep Lyme as a possibility if there's an unexplained illness. The monitoring and supportive care is important for a good outcome. So I'm going to go through a quiz just to see what we know about Jarisch-Herxheimer reactions from this case I'm presenting and what you know about Jarisch-Herxheimer reactions. So what is a Jarisch-Herxheimer reaction? Is it a severe allergic reaction to antibodies, a transient reaction to the rapid killing of spirochetes leading to an inflammatory response, a long-term complication of Lyme disease, or a viral infection? In this case, it's a transient reaction to a rapid killing of spirochetes leading to an inflammatory response. Now, what were the primary symptoms observed in a newborn case study? In this case, there was decreased activity, poor feeding, and abdominal distension, which could happen in a child. In this case, it was easy to come to a conclusion that Lyme should be a consideration given the tick and the rash. How was the newborn likely infected with Lyme disease? In this case, a recent tick bite with erythema migrans rash. There are rare cases of congenital transmission from the mother. And which antibiotic was used to treat? As I said, ceftriaxone made sense because it was a newborn and they were in the hospital and they wanted immediate treatment. Now, Ceftriaxone doesn't work for some of the co-infections like Babesia, anaplasmosis, and Ehrlichia. So there was no evidence that the child had ongoing symptoms afterwards, but it's something I always keep that in mind. How soon after starting treatment did the newborn develop a Herxheimer reaction? 2 hours. Which of the following mediators plays a key role in the inflammatory response of Herxheimer? As I said in the case discussion, is that tumor necrosis factor, interleukins, cytokines are implicated. And why can Lyme disease tests be negative in neonates despite active infection? As we know, the blood tests are not as reliable as we'd like in any age. But in this case, newborns did not produce antibodies early in the disease, probably due to how the immune system works in newborns. Which of the following is an appropriate supportive care measure for managing a newborn with Jarisch-Herxheimer reaction? Stopping antibiotic is a problem because if they have Lyme and you stop too quick, you might have a persistent infection. Steroids are something we try to avoid during an infection. We usually monitor vital signs, provide fluids, and make sure there's not another illness there. And besides Lyme, which of the following infections is associated with a Herxheimer reaction? Syphilis is how they originally described Jarisch-Herxheimer reaction. And which symptom might signal Herx in a newborn? In this case, that was sudden fever and rapid heart rate. Thank you for joining me for this Common Sense Lyme series with a quiz. I hope you did well during the quiz. There's always something to discuss, so leave those comments below. And thank you for joining me. Have a good day.